Hi, I'm Britt Carlson with Oroville Hospital. Today we're speaking with Dr. Kash Vang. Thanks for joining us today, Dr. Vang.
It's a pleasure being here.
So we have a very important topic to discuss, hepatitis B, specifically in Southeastern Asian communities. But first I want to hear a little bit about you. You're actually a native of the Oroville area.
Oh yeah, certainly. I actually grew up here in town. My family moved here back in 1989, and we've been here since. At least my parents have been here since. And so, I just went on to school, just came back here. 2006, I finished my training and just came back here and to start working in the community. I worked for a couple of years for a primary care clinic here in town, and then about 4 or 5 years ago, I made the transition over to work as a full-time hospitalist for Oroville Hospital. And additionally, I also do some primary care, also associated with the hospital. And currently I'm supervising a physician assistant who provides primary care for the Hmong community in particular through Oroville Hospital as well. So I still have a lot of contacts in association with the community. And one of my interests is caring for people who are afflicted with hepatitis B, and also try to educate other providers in the community and also the Hmong population at large about the disease, about the condition.
And tell us a little bit about why, specifically you want providers to focus a little bit more on the Hmong community in testing hepatitis B.
Sure. Well, I know that there are some providers who are aware of the high prevalence of the conditions in the community, but there are other providers who may not be as aware that this is a serious issue. This is a common disease. For example, in the Caucasian population, hepatitis B probably have a prevalence of less than 1% or so, as opposed to in the Asian community, particularly Southeast Asian, it can go anywhere from 10% to 15% based on the most recent study and based on what community you are from. And so it's a silent disease. And so, unless the patient presents to the hospital or to the clinic with the late stage of the disease already, such as, liver failure and being yellow, jaundice there, you don't really catch it. And we don't routinely screen for hepatitis B. So I just kind of want to get the word out that if you see a patient of Southeast Asian origin or Chinese or Vietnamese, for example, you should definitely do, if they have not known their hepatitis B status, get a screening test, a simple, easy blood draw, and you can certainly make a difference in their life. And
if you can catch it early, it sounds like there are more treatment options.
Oh yes, most definitely. It's a virus, it's an infection, and there are good medications that if the patient's infected, you can catch it early. You can do the appropriate follow-up with a lab test to check for liver cancer, ultrasound to check for liver cancer, and also can prescribe them medications to treat the infection, to keep it under control. Sometimes if you have access to specialty care, infectious disease, you can refer them to it. But if you're in a small community like Oroville, you don't have easy access to infectious disease. These treatment regimens are simple enough that you can actually do a lot of the treatment yourself. And so I would certainly strongly encourage a lot of my colleagues who are particularly in the primary care setting to definitely do the screening, particularly if they're born in their country of origin, or if they travel there a lot. To do the screening. Yeah.
Now, if people would like to contact you or ask you a few more questions, if they particularly are living in the Hmong community or have traveled to the Southeast, how can they get a hold of you?
I still have certainly association with the clinic, which I supervise the physician assistant. The phone number there is 534-9183. and I spend most of my time here at the hospital. And you can get hold of me at 532-8500, and I'll be more than happy to certainly help to answer any questions. By no means, I'm not an expert in hepatitis B in training, but I do have a lot of experience treating the patients from the Hmong community in regards to this. So I'll do my best to address your concern, and if I need help, I certainly have the resource to refer you to. So,
all right. Well, thanks for bringing such an interesting and important topic to us today.
Thank you.
You're welcome.